everybody. Welcome back to the Medicare channel. This is Holly Cohen, and I want to teach you today how I've taught agents and how I teach all of our clients to understand Medicare in a very simple format. It's a simple chart, and I'm going to take you to it right now. So I've been teaching Medicare a really long time to our clients. I've trained agents, and it's very easy to understand if you follow along with me in this video. Please, first and foremost, take out a pen and some paper. You can use a crayon or a marker if you'd like, and let's get started. So on your paper, just simply draw one straight line down the middle of your paper and then one straight line across, giving yourself 4 equal boxes. So up in the upper left-hand box, go ahead, please write letter A as in apple. On the upper right-hand box, please write letter B as in boy. In the lower left-hand box, please write the letter C as in cat. And in the lower right-hand box, please write letter G as in girl. I'm going to educate you. You're going to understand it by the end of this video. I promise you are going to master Medicare. So let's first off talk about part A as in apple. And I'm actually going to switch over to typing because my handwriting is not very legible when I'm using a mouse. So let's talk about the part A of Medicare. Part A, as in apple, is the inpatient side of Medicare, meaning anytime you sleep overnight for medical treatment, it is billed to Part A of Original Medicare if you're on Original Medicare. So under Part A, please write the following. These are inpatient items. So you have hospital, have hospice care, and lastly, you have nursing home care, skilled nursing. Okay. So part A is everything that is inpatient, and also it involves anything that is related to hospital, hospice care, or skilled nursing. So again, anytime that you sleep overnight for medical treatment, again, we call that inpatient, overnight stay for medical care. Okay, so this is all the Part A of Medicare. It is hospital, hospice care, skilled nursing, inpatient, overnight stay for medical care. Now, Part A, as in Apple, is what we pay into all the years that we have worked. We actually pay into it. So then by the time that we turn 65, it's free. No matter if you're still working or not, you're still entitled to your Part A if you've at least worked 40 credits, which equals 10 years in the United States, and paid into the Social Security system. So Medicare, original Medicare, if you have a hospital stay or in hospice, God forbid, or skilled nursing, then Medicare will pay, original Medicare will pay 80% of your bill. So that does leave the patient with a remaining 20% that they owe. Medicare doesn't cover 100% of hospital, hospice care, or skilled nursing. Now, let's move over to Part B, as in boy. So head over to the right, and underneath there, let's take some notes. What is Part B? Part B of Medicare is everything that is outpatient, meaning anytime you have medical treatment, you see your doctor, you go for tests, you have x-rays, whatever you want to think of, but you come home that day and you sleep in your own bed that day. You're not sleeping overnight, so it's considered outpatient. That is Part B. So let me give you a little laundry list of items. What's covered under Part B? Here we go. Part B of Medicare includes your doctor's visits, it includes all tests, it includes all durable medical equipment, like insulin, pumps, oxygen, wheelchairs, things that you would purchase at a medical supply store. It also covers any outpatient surgeries. And also, it would include anything such as chemotherapy treatment. I have a lot of clients that do have infusions or injections at their doctor's office. All of these items that I just described are outpatient, right? Outpatient, right here. Outpatient. So when it's outpatient, again, it does mean you come home the same day. Medicare Part B, like boy, this year, 2023, has a once per year deductible. And that amount equals this year $226 for the entire year. That's the Part B deductible, $226 for the year. Once this amount has been met in medical bills or medical costs of any outpatient services, then once again, Medicare will pay 80% of your bill only. So just like in Part A, I wrote percent. Sorry about that, guys. Part A, Medicare pays 80%. Part B, Medicare also pays 80% of the bill. Okay, but only 80%. So now that that's all understood, there's a few other items that we need to talk about under Part B. How much does Part B cost? We said that Part A over here is actually, let me write it down here, is actually free. Because you've already paid into it, you've worked your entire life or part of your life or enough time in your life to be entitled to Part A once we turn 65 in the US. That's just how it is with our Medicare system. So what I am describing as Part A and Part B, these are parts of original Medicare. So let me put that down here just so that we understand. This is called original Medicare. And so is Part B. It's called original. My caps on, sorry. Original Medicare. So Part A and Part B are only part of original Medicare, where original Medicare are federal, red, white, and blue. Medicare fund will pay 80% of your bill, and the patient is still responsible in Part A and Part B for the 20% left over, such as down here. You still owe 20%. The patient still owes 20% of the bill. Okay. So here's where the confusion always sets in for everyone. And it's not just you. A lot of it's marketing. There's a lot behind it, but we're not going to get into that. We're strictly explaining Medicare to you today with my very interesting T-chart that I've used. Okay. So I've explained A, I've explained B. Now let's jump over to what is Plan G. What is this G down here? So a G, as in girl, its job is to be a federal extension of your original Medicare. What the heck does that mean? Federal extension of original Medicare. Original Medicare is our red, white, and blue system. It is the money we pay into, and that's what pays our 80% if we keep original Medicare as our main insurance, as our primary once we start onto Medicare. So this Plan G down here, G like girl, its job is to pay the 20% left over after you've satisfied the $226 for the year in medical bills. And just as a side note, you should never be asked to pay that in a doctor's office. Your doctor must bill or outpatient facility must bill Medicare first, and then Medicare must process the claims, and then you will receive bills that will equal exactly up to the penny of $226 for the year. If you're on original Medicare with a Plan G, that is how your insurance would work, your Medicare works. You have A, which pays 80% of all your medical bills. You have Part B, which your only out-of-pocket cost for the year is the $226. And then you have this Plan G, which we call a Medicare supplement plan. Please write that on your paper. We also do have another word for this, and it's called a Medigap plan. Same thing. So a G plan, you may have heard if you talk to anyone older than yourself, there was Plan F back in 2020. It was discontinued for anyone born 1955 or after. So if you're new to Medicare and you were born 1955 or after, you're eligible for Plan G, which means that your only out of pocket for the year is this $226. The Plan F, which again has been discontinued, that plan was almost identical to Plan G, almost a twin, except for one thing. The Plan F pays this $226 for the year. Plan G does not pay it, therefore the patient, you come out of pocket for that amount for the year. So just as a recap, Medicare pays 80% on Plan G because it keeps you on original Medicare. Your Plan G would fill in the gap and pay the 20%. And then you're only responsible for this $226 per year. Now, let's talk about something very, very different. Let's keep this thought. This is called original Medicare and Plan G, or if you were born before 1955, you are entitled to Plan F, and Plan F pays the 20% and the $226. Plan F tends to be about $50 a month higher. So most people do opt for Plan G because why would you want to spend $50 a month times 12 equals $600. So why would you want to spend $600 just to pay off $226 of a deductible for the year? So that's why most people who even have been on Plan F, if they're very healthy, they can switch over to Plan G. So let's go over here for a moment and let's talk about this. Letter C. What is Part C? You've heard it on television. There's a lot of commercials about Part C. What is it exactly? We call this a Medicare. There's a lot of controversy using the word Medicare because it's not Medicare. It's a Medicare Advantage plan. What does that mean? It means it's an alternative to original. Also, we can call it traditional Medicare. So our original or traditional Medicare system that was established started in 1966. It was introduced in 65, brought out in 66. It's original Medicare. We also call it traditional Medicare. The Medicare Advantage Plan, also known as Part C, okay, is a Medicare Advantage plan. It's an alternative to original traditional Medicare. Here's some other information about it. It replaces original Medicare. So today I had a phone call. A gentleman called me and he was just trying to get some information. He asked me, can you have a Plan G at the same time as a Part C? So in other words, can you have a Medicare supplement, also known as Medigap plan, at the same time that you have a Medicare Advantage plan? The answer is absolutely no. The federal government only allows you to pick one or the other. So your choices are either you keep original Medicare and you enroll in a Plan G, or you do the alternate to traditional Medicare and you go on the Medicare Advantage plan. So now let's talk about some pros and cons of these two options. Let's go back over to Plan G. So Plan G does keep you on original Medicare, meaning if you go to a doctor, if you go to a hospital under Part A, The hospital will bill our federal Medicare, no questions asked. If your doctor has ordered it, it's medically necessary. Original Medicare must pay the first 80% of your bill. If you go to your doctor or you have tests or you purchase durable medical equipment and you're on original Medicare with a plan G or a plan F, then the doctors and the testing centers and the durable medical equipment companies and the chemotherapy outpatient centers will bill original Medicare. They'll bill our fund, our original money, or Medicare money that we pay into. And Medicare will pay those providers back 80% of the bill, and your G plan will fill in the gap and pay the 20%. And you're just responsible for this 226 for the year. Now, let me take a step back. Part B as in boy, it does cost everybody. No matter if you keep original Medicare and you enroll in Plan G, or if you decide to go with a Medicare Advantage plan, no matter what, unless you qualify based on income, almost every American, or many Americans, there's low income that don't pay this premium, but most middle Americans do pay this premium per month. And if you happen to have more income or a higher threshold of income, which I cover in other videos, then you may pay more. But most Americans pay this year in 2023, you pay $164.90. But that's how much it is per month for Part B. Your Part B premium equals $164.90 per month. All right, so no matter whether you're on Plan G or Plan F or Part C, as in CAT, which is Medicare Advantage, you still pay it comes out of your Social Security check if you're collecting Social Security. If you're not yet collecting Social Security, then you will owe Medicare monthly $164.90 either way. So why would somebody choose to do a Medigap or Medicare supplement plan versus a Medicare Advantage plan? So let's talk about some pros and some cons quickly. So a Plan G or Plan F, but again, we're going to focus here on Plan G because most people who are new to Medicare are born after 1955 right now in the year 2023. Plan G, again, pays the 20% in full of Part A and Part B. So in other words, anything your doctor orders for you that's considered medically necessary, Medicare is going to pay 80% of the cost. And Plan G, by federal law, is going to fill in that gap and pay that balance of that bill of the 20%. And you're just responsible for the first $226 of the year, which would be as you use it at the doctor's office, testing, durable medical equipment, outpatient surgery, chemotherapy, infusions, injections in a doctor's office. And there's a few other items under Part B. Anything that's outpatient, again, $226 for the year on the G plan, anything your doctor orders. Also, on Plan G, because you're on original Medicare, you can go to any doctor and hospital throughout the whole United States that accepts your red, white, and blue Medicare card. So in other words, there are no networks if you choose to go on a Medigap, Medicare Supplement Plan G. No networks. There's never prior authorizations. Simple. It's so simple. You have your A, your B, you have a Plan G. Every bill is paid for. No matter what, you still have to pay that $164.90 a month, and the Plan G pays the balance. You could literally have anything happen, a heart transplant, chemotherapy treatments, whatever it may be. Your only out of pocket for the year is the $226 because Medicare will pay the first 80% and Medigap Plan G will fill in and pay the 20%. Now, Medigap plans do cost money. They are state by state. They're even based on your zip code. It gets down to your zip code and your age. And it also depends on if you are married or you live with someone. Some companies do offer a discount, but just for giggles, let's approximate the cost of Plan G. And also men are slightly more expensive than women, but just ballpark figure, a cost of Plan G across the country is anywhere from $100 to, and let's just, some 3 states in the US, California, New York, Florida, are higher, but most states are going to go up to about $130 maximum And most people, whether you're male or female, are going to fall somewhere in the lower $100 range per month. So it doesn't cost a lot to have a plan G if you can afford it. If you can pay the extra Medicare supplement, Medigap plan premium each month, if you can afford that in addition to the 164.90, then you have the best insurance you could possibly have in our country. It's original Medicare and it's a plan G. Okay. So that all being said, let's talk about what is it, why would somebody not go with that? Well, number one, finances. That's definitely, and then also the commercials that are nonstop talking about Medicare Advantage and all their extra benefits, et cetera. So let's talk about Medicare Advantage. And my agency represents both Medigap plans, Medicare Supplement, and Medicare Advantage plans. So we're not biased. We just do what's right for you. And that's where my heart is. That's where any of our agents' hearts are. That's how I've trained everybody always, to put you first. So let's talk about Medicare Advantage. It is, as we said, an alternative to original Medicare, replaces your original Medicare. It is $0. So a lot of people do like that. It doesn't cost anything. It's a $0 premium plan. So sometimes it does cost a little bit, but most of these plans are $0 per month. Okay, so you're not paying an additional premium to have a Medigap plan. But as I said, it's an alternative to traditional or original Medicare. It replaces your original Medicare. You literally would put your red, white, and blue card that has your A and B on it in a drawer or in a safe, lock it up, because it's never going to be used. If you're on Medicare Advantage, you would only be using one card from the insurance company, because the insurance company would be in first position, in the only position, because it literally knocks original Medicare off the block and it's replaced by the Advantage plan. These plans do have networks. So let's talk about networks. They have a PPO or an HMO network, which means that you have to make sure your doctors and hospitals are inside the network. Very important. There's a lot of call centers out there that are calling people who are turning 65. I hope you're not one of them getting swarmed. You're probably getting swarmed with mail, but most of that mail and a lot of those calls are about Medicare Advantage. So just be aware that there's a major difference between being on original Medicare with a Plan G versus being on a Medicare Advantage plan. The other thing on Medicare Advantage that a lot of people do not like, because it is free, but nothing in life is $0. There's always costs. So there's an out-of-pocket maximum on this plan. Most of the nationwide PPO, large insurance company plans that many of the doctors around the country do accept have a maximum out-of-pocket cost. And let's type that up here because I can't see it. They have a maximum out-of-pocket cost. Once you click off, anyway, maximum out-of-pocket cost of, here's the big news, guys, $8,300 in network. If you happen to find yourself out of network on one of these plans, it can go as high as $11,000 out of network. These plans do make sense for a lot of Americans. Okay, I know this sounds like a lot of money, but I have a lot of healthy clients that are healthy at 65, they're healthy at 70, they're healthy at 80, and they keep their Advantage plans for life. But the most important thing that I want to share with you right now about original Medicare and a Plan G is this. So write it down, take notes, circle it. Here we go. Plan G, you're only entitled to a Medicare supplement plan or Medigap plan in the initial enrollment period of Medicare. What does that mean? It means right when you're beginning Part B, you have a 6 month window. I like to call your personal enrollment window. Let's write that up here. It's called your personal enrollment, which I coined the phrase. personal enrollment window. It's the only time in your life, you have 6 months before your Part B kicks in. So if you're starting Medicare on May 1st, you've had 6 months prior to May 1st to enroll in a Medigap or Medicare Supplement Plan G without any health underwriting questions. You also have 5 months after the effective date of your Part B to not have those medical underwriting questions asked of you. So what that means is you have an 11-month period, 6 months before, 5 months after your Part B start date, where there are no health questions in your entire life. But once that period of time is gone, it's gone. And anytime, for example, if you start on Medicare Advantage, and then you decide later on, say a year and a half down the road, that you want to go back on original Medicare because you have some health conditions and you would like more freedom and flexibility that original Medicare and Plan G offers you, you'd have to go through medical questions. And an agent like myself, we have to take all of your prescriptions. We have to ask what they're taken for. We have to submit the application to underwriting. An underwriter at the insurance company either approves or declines you for this Medigap plan based on health. All G plans, this is also very, very important. I'm going to write it up here. All Medigap or Medicare supplement are standardized. Overlapping. Are standardized by the federal government. Okay, so all Medigap, Medicare supplement plans are standardized by the federal government. That just means that every single Plan G, every single Plan F is exactly the same. Why? Because when you go to a doctor's office and you're on a Plan G or a Plan F, then what happens is they're going to be billing original Medicare. They're not going to be billing if you're on Part C, a Medicare Advantage plan, they would be billing the insurance company. But when you're on original Medicare with a Plan G, they're billing original Medicare. And every single Plan G is the same. So, I mean, literally, I always make a joke. It could say, Kleenex Plan G, Dunkin' Donuts Plan G, Starbucks. It doesn't matter. It could be any brand in America you could think of. They're all insurance companies, but my joke is a G is a G is a G. That's the point. Okay. Any questions, concerns, whatever you need, you can always feel free to give us a call or go on our website. You can go on to www.medigapcares.com. Our agency is preferredmedicareplans.com. And I'll put those in the links below so that you can click and find us. Any questions, we're here to help you throughout the beginning of Medicare, during Medicare, your entire life of Medicare. We get calls all the time, and we really, really enjoy taking care of our clients and helping and educating everyone across the country. Any questions, feel free to give us a call, 855-265-6334. Again, Holly Cohen, and I look forward to seeing you all next time. Take care. Bye-bye.